You refer to stress as a silent killer.
It's something we're not addressing, I think, as a society. So put it in perspective, when you look at risk factors for heart disease, the major ones are smoking, type 2 diabetes, high blood pressure. The risk of heart disease linked to stress, chronic stress of more than a moderate degree, is actually the same as being a smoker or having high blood pressure or having type 2 diabetes. And most people, I think, are not managing it. And certainly of all the patients I see, all the heart patients I see, invariably, all of them have had, over the preceding years before their heart attack, stress levels that are quite high. What's the mechanism? So from an evolutionary perspective, if we were acute stress can be a lifesaver, right? If we were running away from a saber-toothed tiger, right, then what happens is the body produces clotting factors and inflammatory markers, factors in the blood, that if we were attacked, they help reduce the risk of us bleeding to death. So imagine that happening chronic stress. You've got a low grade, what we call chronic inflammation, and clotting factors increase. And that's been shown, actually, and proven in a study that was published in The Lancet a few years ago, where they did an MRI of the brain of young, healthy people, adults, and they followed them up, but they looked at their subjective stress scores. They did questionnaires to measure their stress levels subjectively. They correlated that with looking at the amygdala in the brain, which is the emotional center. And then they looked at clotting factors, and they even looked at heart attacks further down the line. And there was a perfect correlation with the subjective stress score, the amygdala lighting up, the clotting factors in the blood, the inflammatory markers in the blood, and heart attacks. So we've got the plausible mechanism. So if that's the case, Steve, there must be a way of curbing it. And, well, how does one do that? Well, the two most important causes of stress in society are work and relationship stress. So those are things people can potentially work on, right? Potentially, but it's just to be aware of it. But one of the interventions that I use with my patients is actually breathwork and meditation. And one of the most extraordinary bits of research that I came across, and it's in our documentary as well, because we go into a bit more detail on it. I had to go and see it for myself to believe it, actually properly believe it. A cardiologist in India for more than 20 years has been, through a lifestyle approach, has been reversing heart disease. So he did a study called the Mount Abu, that's a place in northern India, where he's got a huge community and a hospital. People come to see him there. And he puts them through this lifestyle plan, which in this study was, they're devout Hindus, so it was a high fiber vegetarian diet. It was 2 30-minute brisk walks a day, okay? And something called Raj Yoga meditation for 40 minutes, which is a form of breath work, but it's also a bit of a spiritual transformation as well. It's about understanding where your anger comes from and all that kind of stuff. So it goes quite deep. And anyway, he followed these people up who were diagnosed with at least 50 to 70% blockages in their arteries. They had heart disease. For some reason, they didn't want to have a bypass operation or a stent, or they couldn't afford it. And they wanted this lifestyle plan. So he put them on a lifestyle plan. He repeated their angiograms after 2 years, right? He looked at the arteries again. And on the people that had adhered to the plan, there was an average reduction of the blockage of 20%. 70% became 50, 50 became 30. This is unheard of. If you ask any cardiologist, can heart disease be reversed? Saying, no, I've never even seen it. It's not possible, right? But he showed this to be the case. He then looked at his data in a bit more detail and said, was it the diet? Was it the exercise, or was it the stress reduction? Of course, they're all important, but the only independent factor for the reversal of the blockages was 40 minutes of Raj Yoga meditation per day. Now, I asked him, he published this data in what we call an observational study. It wasn't what we call a randomized trial where it was just more rigorously done. And he said, why have you not done the randomized trial? I said, I have, years ago. And he showed me the data, and I was like, wow, why didn't you publish this anywhere? Couldn't get it published. He invited, and I could be wrong about it. It was a senior cardiology society. Can't remember if it was the American Heart Association, but it was a senior cardiology society in America. He invited them to India so he could present his data. He presented his data to them, and they basically thought it was fascinating. But in between the lines, they said to him, we can't publish this because it will affect our stent business.
And what's a stent business?
Stent is basically the heart stents, like as in it would, I remember, Steve, when I first wrote an article, the first sort of mainstream media article I wrote in 2011 was me. It was in the Observer newspaper. I'd met Jamie Oliver, having written to him saying, can you sort hospital food out? And then I ended up writing an article called I Mend Hearts. Then I see our hospitals serve junk food to my patients. Basically saying, listen, we're going to tackle this obesity epidemic, tackle heart disease. We need to sort the diet out. And I remember one of the cardiologists who I knew, a senior cardiologist, I was still a junior doctor at this point, kind of tongue in cheek, but many truths are spoken, and just said, Aseem, this is going to affect our business, our stent business, as in operating on people, as if it was a bad thing that I was saying that we should basically prevent heart disease, right? There's a cultural problem here, Steve, honestly. This is a dirty secret, if you like, within medicine, unfortunately, amongst establishment figures, is that they have become so wedded and so close to these tyrannical corporations or their own self-interest that, we're missing a big trick here in terms of what we can really do for patients.
In part, your other book here that I have, I still can't pronounce this word, Pyope
diet.
Your Pyope diet, I guess, serves to address many of these issues and to make sure that our hearts stay healthy. What I wanted you to do for me is, if I'm endeavoring to have a good heart health until I die, which I guess is kind of impossible, but maybe I'll get hit by a truck or something. If I'm endeavoring to have good heart health, what should my daily in an optimal situation, what should my daily routine look like?
Okay.
If I follow the diet that you came up with, but also if I'm thinking through all of the potential things that can cause bad health.
Sleep.
I wake up, so I sleep for 7 hours.
Yeah,
8 hours.
So at least 7 hours sleep. Great.
Okay,
that's the tick.
Yeah.
Okay. Eating real food.
Okay, so breakfast is how many meals a day should I have?
Well, 2 to 3, whatever suits you. When you feel hungry, eat till you're full.
Not 7, 8, 9. Not no.
Just eat, and also I suppose if you're doing activity, then you may. But the most important thing is to avoid the ultra processed food, and not to have too much starch.
What about fasting?
Controversial area, mixed data. I think that in terms of, I have patients who feel benefit from fasting and other people feel more stressed. It depends where you are in your life. If, for example, you're very active and your sleep isn't good, actually fasting can make your stress levels worse, which is not good. It causes cortisol to increase. And there is some data showing that happens. So it depends where you are, but I'm not averse to fasting. It depends, see how people feel.
Okay, so I've woken up, I've had 7 hours of sleep.
Yeah.
I've eaten breakfast, which was whole foods. So
yeah. And okay,
no
so I would
processed
say, whole fruit and vegetables, ideally. A mixture of low sugar fruits, if you can, ideally. Berries, mixed berries, for example. If you can get at least 5 to 7 portions in, that's great. The foods that are thought, so the anti-inflammatory foods that have got a reasonable body of evidence behind them are things like extra virgin olive oil is your base fat. Okay, nuts and seeds, tree nuts, almonds, walnuts, hazelnuts, for example. Oily fish at least a couple of times a week, right? And then I would say minimizing, the starch and the sugar.
Okay.
And the rest of it doesn't matter. You can have, I have heart patients asking me whether they can eat a steak. I say, absolutely. It's not going to cause, it's very nutritious. If you want to have a steak 2 or 3 times a week, no issue. Saturated fat in the diet isn't a problem. I busted that myth. So butter, cheese, for example, red meat is not going to have any adverse effect on your heart.
Okay, so I've eaten my breakfast.
You want to enjoy your food as well, right?
Yeah. So that's my sleep taken care of, my meals that day taken care of. Yeah. What else do I need to be thinking about to optimize heart health?
Well, I suppose you've got to think about what level. It's very subjective. If you're stressed. Mm-hmm. And if you're stressed, then you need to think about what can you do about it. And there are different things. Some people find exercise is good. Some people do yoga. They do Pilates. Some people do breath work. So try and find. So I have an app called Calm, which I listen to. I do at least 20 to 30, sometimes 40 minutes of breath work every morning when I wake up. It's the first thing I do, actually.
I'm going to do both. I'm going to do breath work and I'm going to go for a long workout. Is there such a thing as too much exercise?
Yeah, unfortunately, yes. About 11% of elite athletes by the time they reach 50 will have scans that show very severe blockages or a heart disease, right? And I think, Steve, to be honest, it might be genetic predisposition, but I think a lot of those people, because I have some of these people coming to me who don't know why they've got diagnosed with heart disease. And I remember one lady I saw a few months ago, and she was running something crazy like 5 to 10 miles a day, but on only 4 hours sleep. And she was young and otherwise didn't have a diabetes or anything else, but had heart disease, had developed heart disease. And I said, this is probably because of this. So I think that when you look at heart disease and optimal levels of exercise, it is actually the one thing I think the guidelines are right about is probably that 150 minutes of moderate activity a week. So, I follow my own advice, and I will, I used to run, but, running can be quite damaging to the knees, especially as you get older. So I cycle and do exercise bike and whatever else. And I will get my heart rate to about 115 beats a minute for 30 minutes, 5 times a week.
One study found that marathon runners experience a frequency of heart attacks and strokes similar to people who already have heart disease, suggesting too much exercise is harmful, which is in your book, Statin Free. And another stat here is athletes who do more than 1 hour of intense exercise per day 4 times have 4 times the frequency of breathing infections per year compared to those who do moderate activity.
Well, that's the other thing about over-exercising. Well, it depresses the immune system. That's well known. In fact, if you look at, and a lot of people do it for different reasons, but if you look at the communities around the world known as the blue zones, Steve, where people have high longevity, these people weren't pounding it in the gym. They're just outside, they were gardening, they were moving. You don't need to be doing all of that kind of stuff. People do it for different reasons. I mean, I do it sometimes. Oh, also for mental health, it's good.
You didn't you publish an article? You co-authored an article for the British Journal of Sports and Medicine called "It's Time to Bust the Myth of Physical Activity."
Yeah, physical inactivity and obesity. You can't outrun a bad diet. That was the title of the article. And the point was, and we make it very clear at the beginning, that exercise has many benefits for health, but weight loss is not one of them, because most of what determines your weight gain, almost all of it, is to do with what you eat. And that discussion or that thinking, whether it was about burning calories, actually came from the food industry. They manufactured that. Coca-Cola, McDonald's, they would push this. The Olympic Games 2012, they were the main sponsors, right? Because for them, they want to distract from their unhealthy products and say, well, the obesity epidemic has been driven by people not exercising.
So on that day, on this perfect day that I'm creating in my mind, I'm eating well, I've moved, but not too much. I'm doing breath work in the morning. I've slept 7 hours a day. And the last thing that from looking at your 21-day immunity plan is socializing.
Yeah. So important. I think one of the most important aspects for mental health, physical health, is the quality of our relationships, friends, family. People may laugh at this, but I actually prescribe hugging to a lot of my patients, especially couples. There is definitely some benefits from that, and in terms of reducing cortisol levels, etc. I think that's an issue in society in general. We have been conditioned in a way to think that we can just be dependent on ourselves as individuals and we don't need other people, but actually we do. That's how we evolved. Partly because it helps us feel safe.
Hugging.
I think it activates parts of the brain, the protection, soothing mechanisms of the brain, and I think that is just an extra element of it. Absolutely.
And it reduces cortisol and all those things. Absolutely. So it's going to stave off heart attacks. If we hug, we have less chance of having a heart attack.
It's not just about that. I think it's also good for the immune system. So the people that did the original cold studies on cold viruses, this was done, I think, in early 2000s, fascinating study. They inoculated people with the cold virus. So they put the traditional cold virus, whatever, into people's nasal passages. And they looked at who developed symptoms of a cold and who didn't. And they looked, and before they did that, they did these questionnaires based upon several different aspects of people's social life. Are they involved in community activities? How often do they meet their friends? What's it like with their partner, et cetera, et cetera? And the people who had the highest scores, only 1 in 3 of those people developed a cold. And the people on the other side that were maybe more lonely and weren't interacting with other people, who didn't have good quality relationships, 2 out of 3 of those people developed colds. So it's not just about heart disease, it's about the immune system as well, overall health.
Makes you think, doesn't it? If loneliness really is killing us, we need to try and do more to end the epidemic that is loneliness, because the stats seem to suggest it's going one way and it's not a good way.
And part of that issue as well, Steve, which is something we need to think about with what's going on in society, is we've got a worsening mental health crisis. We've got less trust in government. One of the ways societies progress is people being able to trust each other by people not being afraid to speak the truth. And more than ever, and certainly I've seen it in medicine, we have got to a situation, and COVID vaccine is a microcosm of something much bigger, where people are afraid to speak the truth. And that gives us an element of uncertainty, distrust, and it makes us more stressed. So what this means, what it comes back to, is ultimately part of the solution to the mental, physical, social well-being crisis, heart disease, is thinking about acting from a place of virtue and ethics, right? Thinking about, your intentions, being honest, not manipulating other people for money. This is unfortunately where the capitalist system or the current economic system has taken us, and the corporatization of human beings as a result. And that is very detrimental to our physical and mental health.
If you love the Diary of a CEO brand and you watch this channel, please do me a huge favor. Become part of the 15% of the viewers on this channel that have hit the subscribe button. It helps us tremendously, and the bigger the channel gets, the bigger the guests.